Someone needs to have that fixed.
Does that ever happen to you? Well, if it does, you're not alone. But what you may not realize is tripping over obstacles like that, either real or imaginary, is completely preventable. And not by the city government doing a better job on its maintenance schedule. It's preventable by working on more conscious walking technique. That is something that so many people ignore. Not only will working on your walking technique help reduce your risk of tripping and falling, it's also going to help with your spinal and joint alignment. Imagine this scenario. If your front left tire became worn out on the outer edge, would you consider that normal wear and tear, or would you consider that a problem with alignment that is fixable by proper maintenance? Well, wear and tear on our joints and our spine are similar most of the time. We can prevent wear and tear, arthritis, inflammation, and pain by keeping ourselves maintained with proper alignment, and part of that is by learning proper walking technique. If you're new to the channel, I'm Dr. Todd Martin, creator of the Walking Code, and in this video, I'm going to share with you my top walking tips that you didn't even know you needed to know. If you get value from this video, make sure to click the like button and subscribe to the channel. Share this with your friends so they can also benefit from understanding the importance of proper walking technique. And drop me a comment, let me know what you think. Let's go ahead and get started.
Tip number 1, heads up, eyes on a swivel. My first tip is to keep your head elevated so your neck is vertically aligned. Imagine your head being stretched upward by a helium balloon, elongating your neck and extending that elongation all the way down your back. Your gaze should generally be straight forward, watching what's coming up in front of you. If you find yourself in a setting where the condition of the ground may be a bit sketchy, it is best to adjust your gaze downward as needed without bending your head forward. Adjusting the gaze downward temporarily will give you a more detailed view of the ground coming up, but there should be no need to continuously gaze down once you have quickly scanned the next 20 or so feet in front of you. Keeping your gaze forward most of the time is not only going to help you keep your spine aligned, it's also going to help make you look and feel more confident, allowing you to engage better with people, not the ground. Of course, there are some environments that will require more ground scrutiny than others. One other caveat: if you feel that you're at risk of falling, don't ignore it. That is something you should get checked out by a doctor to make sure that you're safe. Integrative exercise programs like Tai Chi can be very helpful for those who feel at risk of falling.
My next tip is reciprocal arm swing, meaning the right arm swings forward with the left leg and the left arm swings forward with the right leg. There's a few important details regarding the reciprocal arm swing that I want to cover in this tip. First of all, as I mentioned, left arm with the right leg and right arm with the left leg. The arm swing is not done because we're trying to swing the arms. The arm swing is coming from the rotation of our waist muscles in the core. We are constantly rotating the core, and that is controlling the arm swing. So if your arm swing is not optimal, it means there's something going wrong with the rotation of your core or the way you're controlling your power with your hips. And the focus needs to be on trying to fix those core movements. But visually speaking, this is what we are looking for. First of all, as your arms are swinging forward, the thumb should face forward, not across the body where the palms are facing back. So your palm should face across the body and thumb forward. That is a good indication of proper spinal alignment and even foot position. Because if you notice people who walk with duck feet, they almost always will have their palms facing backward and their thumbs facing across the body. The other thing to watch with reciprocal arm swing is that the arm movement is a forward action, and then it drops back passively to the side of the body. The arm should not be flung back behind the body. If it is, that is a sign of poor pelvic posture and hip action that controls the arm swing and causes it to swing back in that sort of fashion. If you find your arms flinging back behind, it almost always is going to indicate some problem with the core, often an anterior pelvic tilt and overextension of the back, which causes you to drive with your glutes, and that forces the arm swing back behind your body. It can also sometimes indicate that you're overstriding. When people overstride, their arms can swing forcibly forward and back like this. So make sure to watch your stride. It should be a nice, comfortable length so you can control the placement of the heel and not crash into the ground. One thing that people can do to try to improve their consciousness of their walking technique is begin from a standing position and consciously shift your weight and step forward and see if your arm naturally swings with the opposite leg. When I do this in my clinic, at least half of the people start off like that. Not that they're walking that way in their normal daily life, but if they try to move consciously, they end up doing it the wrong way, which means they're not functioning with any sort of real conscious mind-body connection. So try and practice stepping off in a controlled fashion and see if your arms will swing naturally. If you do that practice, I think it's going to help improve your mind-body connection and help you walk more consciously and more fluidly and with more confidence.
Tip number 3 is keeping your feet facing in the direction of travel. That means straight forward when you're walking straight and turning only if you are turning. This allows your ankles, knees, and hips to move in a way that they are anatomically designed to move. This applies on level ground, hills, and stairs. Our feet and lower body joints are not designed to face one direction while the body is moving in another. Walking with the feet turned out is called out-toeing, but most people commonly know it as duckfoot walking. This is one of the most common walking technique variations, and you can see people of every age and fitness level doing it. Walking with out-toeing in adults can lead to several medical problems, including joint pain. Out-toeing can cause abnormal stress on the knees, hips, and ankles, leading to joint pain and discomfort. Muscle strain. The misalignment of the legs can result in muscle imbalance and strain, particularly in the legs and lower back. Footwear wear. Uneven wear on shoes, especially on the outer edges, can occur due to the outward rotation of the feet. Postural issues. Out-toeing can affect overall posture, potentially leading to back pain and other postural problems. Reduced mobility. In severe cases, out-toeing can limit mobility and make walking or running more difficult.
If you find that you're walking with duck feet, I have one tip for how to correct it and then one tip for checking out the cause. So the first thing that we want to do is figure out, is this an anatomical problem or is it a functional problem? It's going to be a lot easier to fix if it's a functional problem. So if you find that you stand or walk with your feet turned out in this manner, the first thing I would recommend doing is running in place like this and see if your feet are facing straight forward when you're running in place. If they are, then it's not an anatomic problem, it's a functional problem. I did a previous video asking people to check this out for themselves and let me know, and 100% of the people who responded indicated that even though they walked with duck feet, when they run in place, their feet are facing straight forward. So it's a pattern recognition problem, and so that's what I want to work on right now and give you this quick tip. If you are walking with duck feet, it means that in almost all cases, you are powering your step by swinging the swing leg forward instead of powering the step using the muscles in the hip of the standing leg to pull your body forward. So if we look at my feet facing out in this manner, somebody who walks with duck feet is using their right hip to swing the leg like this. For people who walk normally, they would at this point be using their left hip to pull the body in line with that left foot. So that is the mechanical situation that's going on. If you find you're walking with duck feet, try to practice powering each step with the standing leg hip. For the practice, face your foot that you're going to be standing on in one direction, and you plan on going in that direction. Shift your weight onto that foot and then pull yourself forward with that hip. Your arm on the side of the standing leg should swing forward with the thumb facing forward, and then your foot should swing forward, the swing leg foot, facing in that same direction. Then put your heel down and move from there. Knowing how to control your root. This next tip may be the most important tip in the video because almost all of the other tips are going to depend on doing this one correctly. And this tip is knowing how to control your root or grounding. And when I'm talking about root, I'm talking about that connection to the ground that we create with our core muscles as we transfer our weight from one leg to the next leg as we walk. Most of us do this unconsciously, but when we don't do it correctly, it leaves us vulnerable for tripping and falling and also for poor joint alignment. So let me give you a little bit of a practice that you can try to control your root. What we're going to do is just practice stepping, placing a foot with no weight on it, and then shifting the weight to the new leg as it releases from the old leg. And then place your foot somewhere else and see if you can control the weight transfer to the new leg while keeping vertical posture. One cheat that some people can do is leaning over the new leg to get your body weight there. You don't want to lean over it. You want to use your core muscles to essentially pull your body weight over to that leg. So there's two important muscles involved in this sort of movement. First of all, it's going to be our lower abdominal muscles here, which rotate back on the side of the leg that we're trying to root. And as they rotate back, in this case to my left, they're being disengaged from the right. So if I'm rooted on the right and I want to change my root to the left, I take the lower abs, which are engaged on the right, think about my belly button turning to the right, and I shift that root and my belly button over to the left. And as I do that, the right leg releases from the ground. The other muscle on top of the lower abdominals that's going to be important, and especially important for preventing you from tripping and falling, is your gluteus medius. The gluteus medius, which is in the back side of your butt, helps to control your pelvic tilt. So as you shift weight over onto one leg, the gluteus medius keeps your pelvis in this position, not letting it tip over this way. And so what that also means is as you activate the gluteus medius, when you're shifting your weight onto your left leg, it's raising the right hip, creating clearance for that right leg to swing freely from the ground. Whereas if your pelvis was tilted this way, you may trip over that right leg because it's not getting clearance. This weight transfer is a gradual continuum. So I go from 0%, 100%, and as I activate and rotate the belly button, I now have 25%, 75%, 50, 50, 75, 25, and then 100, 0. And once I have the 100, 0, I can no longer trip on this swing leg. Even if something knocks it out from me, my weight is all rooted on the new standing leg. That's going to help prevent you from tripping and falling. And it's also going to help keep your knees aligned, because you'll notice as you engage that root, it's also shifting your center of mass over towards the standing leg, lining your knee up with your ankle, as opposed to it being in this position where you're getting a lot of stress on the inside of the joint due to asymmetric weight distribution. Practice this action of the lower abs and the gluteus medius Wind your hip out using your belly button, tucking your pelvis and engaging the gluteus medius here, and then wind it back. And then wind it out and see if you can feel that action. Continuous slow transfer of the root in a controlled fashion, releasing it from the rear leg. And then try on the other leg. Transfer from one to the other. Feel the rotation and the activation of that lower ab muscle and the gluteus medius. That's how you're going to change your weight in a controlled fashion, and then you're going to apply that to your walking technique. Controlling the weight change so you can keep yourself aligned and reduce your risk of tripping and falling.